welcome to the poster. We're going to talk about depression and grief among older adults. I'll walk through just a quick agenda about the things that we're going to talk about. First, we'll start with definition of both grief and depression, and we'll talk about how do you tell the differences, differential diagnosis. A lot of times they overlap quite a bit. And from there, we'll talk about different screening tools that we can use to screen for both depression and grief. We'll talk about causes and correlates for both, and then different interventions that we can use for all of them. So we'll start at the top here. What is depression? What is grief? Why is it important? So it's important because it's prevalent in older adult population. Up to 1 in 10 older adults meet a diagnostic criteria for depression, and oftentimes grief is misdiagnosed as depression or vice versa. So knowing that this is something that we oftentimes see among the older adult population means having some basic information will help us in working with them. What is depression? What is grief? We can define depression as a mood disorder. It's a cluster of symptoms that meet diagnostic criteria for a mood disorder that causes sadness and loss of interest. Those would be the more cardinal symptoms that you would see. Grief is an emotional reaction to a significant life change and a perceived loss. So that could be the death of a loved one or another perceived loss. Things like retirement, job loss, other life transitions that occur throughout lifespan. Those could also be factors that lead to a grief reaction. Grief and depression are oftentimes, the symptoms oftentimes overlap. So we'll talk a little bit about some of the symptoms that are more specific to depression, some that are more specific to grief, and then some that overlap. So with depression, some of the symptoms that we typically will see is a significant loss of interest in anything and everything. So maybe the individual was really interested in gardening, and all of a sudden there's no interest in that or anything else. Another one is lethargy, and that would be both cognitive lethargy, just very fatigued, slow down cognitive processes, or physical lethargy, so just the body movements really slow down significantly. Fatigue or trouble concentrating relates to that, maybe that fuzzy or foggy brain, or that slowed movements. Significant weight change, so there may be changes in eating, and that could be weight gain or weight loss, and something out of the norm, and typically pretty quickly. Feelings of worthlessness is another common symptom in depression. Other things that come along with that, feeling like they don't matter, disconnected. The thing to keep in mind with depression is that these symptoms are pervasive and they last for a minimum of 2 weeks, and those are the symptoms that are more specific to depression. I'm going to jump over to grief and then we'll talk about the overlapping symptoms. So for grief, the symptoms that are more common in grief than depression would be like a yearning or a longing, so really longing for that perceived loss. Recurrent preoccupying thoughts, so thoughts are just ruminating about the loss specifically. And symptoms are more intermittent. So there may be times where the individual seems more upbeat, their mood is more elevated, and other times when they're not. And then we have all the overlapping symptoms, and those include things like sadness, that depressed mood, that's a pretty cardinal symptom for both. Feelings of guilt, sleep disturbances, not sleeping, sleeping too much, suicidal ideation, or it could even be suicidal plan or even attempts, happen in both grief and depression. And other symptoms that may be present for both would be overlaps in anxious symptoms or more withdrawal symptoms, things like that. Important to know kind of the difference between the two, and that the fact that the symptoms sometimes overlap, no wonder they can be easily misdiagnosed, right? So it's helpful to have screening tools for both. So I thought we could play around with a couple of the screening tools. We'll start with depression. One of the most common screening tools across health professions, both mental health, physical health, you see it in primary care settings, hospitals, and mental health, is the patient health questionnaire. There are 2 versions, the PHQ-2 and the PHQ-9. PHQ-2 is simply the first 2 questions on the PHQ-9, and it really is a screen for broad depressive symptoms. And it can be done in self-report, or it can be done in interview fashion. I figured we could just try it out. Deal? All right, so I'll give you a copy here. Thank you. And we are actually going to try out we'll practice just the first 2 questions here. And if you want to team up with a partner and one person attempt asking the questions, either play the role of a patient and answer the questions, and I can come around and answer any questions that you have as you're role playing. Deal? If you just want to get in a group of 3, that works. Okay. Perfect.
Over the last 2 weeks, how often Sure. Alex, over the last 2 weeks, have you often been bothered by any of the following problems? Have you had any little interest or pleasure in doing things?
No.
Have you had any feelings of being down, depressed, or hopelessness?
No.
Have you had any trouble falling or staying asleep or sleeping too much?
No.
Okay.
Feeling bad about yourself or that you are a failure or have let yourself or your family down.
Not at all.
Trouble concentrating on things such as reading the newspaper or watching television.
Several days.
Moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual.
Awesome. So it looks like you were able to do one round of asking the question. So overall, just quick reactions. What did you think about the PHQ 9?
There were some questions, such as moving or speaking so slowly, that weren't things that you would expect to see in depression.
Sure.
So this was kind of a good teaching tool to show us symptoms that we might not normally see or be aware of.
Okay, wonderful. Yeah. So the PHQ really does get at some of those broad depressive symptoms, and it's a screener. So if we complete the screen with a patient or a client and they screen positive, it then gives us an indication that we should refer for additional evaluation. Great. That was a great job. The screening for grief, there's another kind of screening tool called the Grief Questionnaire. That's a hard one to say. And it's 5 questions that really assesses some of those grief symptoms, such as the preoccupying thoughts or the trouble adapting to the perceived loss, those types of things. Same idea. You screen. If they screen positive, then we would refer for additional evaluation. So that's a way for us to screen. Understanding some of the other correlates that we could be looking for when we're working with folks and we may suspect that they may be experiencing either depression or grief include the following. So with depression, there's biomedical, psychosocial, and other considerations for us to take in mind. Where I focus here is considering medications. Some medications may increase risk for depressive symptoms. We want to be familiar with that. Other considerations are the type of medications that an individual may be on for antidepressants and may be needing to shift to a different medication that works better with their biology. Also noting that with older adults, the symptoms for depression oftentimes will come out more in terms of physical pain, aches, different things that we can't really find a physiological underlying cause. So if you're noticing lots of pains and aches that we can't figure out the cause for, it could be related to depression. Other things like neurodegenerative disorders, Alzheimer's, also highly correlated. With psychosocial correlates, considering there's a difference in gender, men and women experience depression differently. Family history impacts if depressive symptoms manifest. And life, right? Lifespan development, considering all the transitions that happen for older adults, that those can lead to sensitive or vulnerable period that may trigger symptoms. And there's a high stigma. So especially among older adults thinking cohort effects, they may not want to seek out mental health services because there's a stigma attached to that. So oftentimes, first line of defense is primary care and screening in physical health care settings. With grief, there's all types of grief, and it depends on the perceived loss. So many factors can feed into grief reaction. And there's no normal grief, no typical grief. Lots of different types of grief in the literature. Grief reaction is typical. Most humans will experience it at some point in their lives. It's when the symptoms become maladaptive that we would then want to get additional services and treatments and interventions. Regarding interventions for depression, lifestyle changes, changes in medication, psychotherapy, including individual or family therapy groups, different things like that, and building supports, educating the family and informal caregivers on what depression looks like and how it manifests among older adults, in addition to just building up support systems. Silver Sneakers is a great option. And then regarding grief, we have 2 main outlets to really turn to, and one is grief counseling, to really focuses and hones in on working through the grief process. And then using the help of other supports, using our helping skills to support them through that overall process. So we just covered a lot of information. Do you have any lingering questions?
I do have a question. Where can I get the PHQ-9 at?
That's a great question. So the PHQ-9 is a free access questionnaire. You can simply Google it to pull up a version, and I would advise all of you to pull up a version of the PHQ and add it to your toolbox. It's a helpful tool for universal screening for this population and to give us a good sense of the patients that we're working with, whether or not referral would be a helpful process for them. Any other questions?
So thank you.
Wonderful. Thank you so much for your attention.
Thank you.
Thank you.